FN600, FN600.com. As mentioned, our guest, Dr. Baronas, from GBMC / Helping Up Mission. He's going to clarify that for us. We got a little sidebar joke there. Doc, how are you this morning?
I'm doing great. How are you, sir?
I am blessed. Now, Doc, you're with GBMC.
Yes, sir.
But you're going to explain to us as we have this conversation the connection with Helping Up Mission, right?
Yes, sir. I definitely will.
Now, at GBMC, now, of course, we know GBMC's main campus is up in Towson, but you guys opened up a primary care office in Baltimore City, correct?
Yes, sir. So we are the very first one. GBMC has a very strong foothold in Baltimore County with a number of advanced primary care practices there. But we didn't have one in Baltimore City, and I think our leadership at GBMC saw that as an issue, as a problem, and wanted to certainly bring our brand of healthcare and specifically primary care to Baltimore City. So in our partnership with Helping Up Mission, we're the first attempt to do that, and we're very excited to be down here in the city.
So that becomes the connection between GBMC and Helping Up Mission. You opened up a primary care office there?
Yes, sir. So we're on the campus of Helping Up Mission, and Helping Up Mission is a spiritual recovery center for men and women that are dealing with different sorts of addiction, usually substance abuse, alcohol, drugs, those kind of things. And they wanted a strong primary care partner, and were reached out around the area, and GBMC was happy to get involved and kind of volunteered to come down and start a campus there, as we were also looking to expand into the city. So it seemed like a perfect match. So how did you two come together? How did you get on each other's radar? Well, I think Helping Up was putting out feelers throughout to see, would there be a larger entity, hospital-based entity to, partner with them. And I think when our leadership heard about that opportunity, Dr. Tucker jumped at the chance to be a part of it, and we're very excited to be down here. And so they had an office here that we came in and completely redid with all new computer system, new chairs, new equipment, and made it nice. And we eventually, when we started here, we were just clients of Helping Up Mission.
Sure.
Both the men down here, and then the women at Chase Street. And Helping Up is building a new women and children's center in the area too, so we're excited to serve them. But after kind of working out those kinks and getting that relationship going, really our main goal also is to serve the residents and regular community of Baltimore City. So we are open for business, and we don't just see the clients, men and women Helping Up Mission. We will see we want to expand into the community and just get out there. I know a lot of the residents of Baltimore City probably don't know GBMC like they know some of the other institutions, but we want to get out there. We want to build those relationships and those trusts and provide great primary care to children, men, women, and anyone of all ages.
So it sounds like to me GBMC became conscious of a need to expand its a sphere of influence as it relates to providing care and target it as a result of a relationship with Helping Up Mission, an area that could benefit greatly from your services.
Yes, sir. I mean that's the goal. Obviously, I'm biased because I'm a primary care physician, but we believe that a lot of health and a lot of these health problems can be prevented with good primary care and forming that relationship, that trust between a patient and their medical provider. And certainly, we see Baltimore City is such a great and vibrant city, but unfortunately, despite having major health institutions, primary care certainly can be lacking, and so we want to try to come in and be a part of that and fill that void, and try to cut things off the past, so to speak, and prevent some of these major health conditions to continue to worsen. So that's our goal, is really to provide that great primary care.
So now you keep saying primary care, and I understand primary care, but for someone who's a little vague with exactly what that encompasses, what kind of services are provided via this primary care? And the second part of that question would be, how has that changed in light of the new COVID-19 reality?
Yeah, so obviously COVID-19 is kind of dominating our lives and the headlines. So, a primary care is what we mean is we like to think of the football analogy as kind of like, the quarterback of kind of, you start there. We start in talking about, healthy diet, making sure blood pressure is under control, getting your blood work, and kind of a jack of all trades, so to speak, provider that,
like the overview.
Yes, correct. Yes, absolutely. Any issue you have, you start there. And primary care has certainly expanded into mental health and dealing with anxiety and depression. And certainly we know that COVID-19 has put amazing stresses on folks,
mentally,
mentally and physically, and has disproportionately affected minorities and other folks that have social economic disadvantages. And so, and that's real life, and that's really affecting people. And so some people don't know where to go, don't know where to turn. And a great place can be starting with your primary care doctor or your family doctor, or your internist, whatever you want to call us. We're a great place to start in terms of anything for your health. And obviously COVID-19 has forced us to evolve, and so a big thing that we do now is telehealth. So we do a lot of telemedicine.
Okay.
Sometimes you can't
explain telehealth.
So telehealth, basically, if you have a smartphone or a computer that has a camera on the end, you can do what we call a telehealth visit, where through our portal or even through other apps.
So you have a virtual doctor's visit? A virtual
Correct. You can have a virtual doctor's visit to talk about anything, and they're a lot more helpful than you think. I think a lot of us, even in primary care, when they first started coming down the pike, were a little skeptical. We like to be in the room with a patient, looking at them face to face, laying hands on them.
Right.
But you can get a lot done over a video, and even myself has been pleasantly surprised at how well that can be in terms of checking in on someone. And a lot of folks have their own blood pressure cuffs at home. If they're diabetic, they can take their sugars at home, and you can still have a pretty effective visit, face to face. Through the phone or a video visit. And especially with things, again, these anxiety and depression and other things like that, that can be very effective to, have those video visits.
So wow, that's great. Now there's one other variable here. Now it's no secret, that corridor is a corridor that's economically challenged. So
Correct.
Your services are very timely there. I grew up in that area, so I'm very sensitive to that area. Helping Up Mission, I'm very sensitive. I've been there several times visiting and trying to encourage the clients there.
Yes.
But also now there's another twist. Not only the economic challenges that literally cause those in areas like that to disproportionately be affected by situations like the uniqueness of COVID-19, but now you got flu season.
Yes.
Are you guys providing flu shots, and how are you kind of integrating all of that into the mix?
Absolutely. So we have flu shots and pneumonia shots and all vaccines and also vaccines for children. We certainly, we want to serve children too, and get those vaccines. And I know there's a lot of, for some people, a negative connotation about the flu shot, but the fact is, flu shots, they definitely save lives, and especially folks with other,
pre-existing conditions
or medical issues, diabetes, smoking, heart disease. We know that, you're much less likely to die if you get your flu shot, and we know that children are much less likely to die from the flu if they get their flu shot. And so we certainly encourage everyone to get their flu shot. We have those here in our clinic. It's very simple to call in to make an appointment and show up. And even if it's just a flu visit, sometimes you don't even have to see a provider. Our wonderful medical assistants and staff will do the shots, and you can come in, get your shot, and register and walk out the door. But certainly, we want to see you as providers. And I always tell people the flu shot is a great opportunity for someone to come in for a physical, a checkup, whatever you'd like to call it. Get to know a new provider if you don't have one, and get your flu shot.
So we really just want to take a second and just thank you and GBMC for being sensitive enough and progressive enough to recognize an opportunity for the hospital also serves as a great benefit for this community down in East Baltimore. I've got a sentimental attachment to it, even though I've been removed from it for a long time, but I've got a sentimental attachment there. And I guess the last thing that we need to do is tell folk, how does this whole scenario work? Can they just walk in? Do they have to set up appointments? I know you talked about the telehealth. You have to set up the appointments. It's not a walk-in facility like a normal clinic. But how does that okay, I wake up and I say, you know what, I need to go see a doctor. And I know GBMC is here. How do I start the process?
So that's a great question. So in the old days we would have said walk in. Obviously in COVID times we're trying to keep with our social distancing, and we want to know who's coming in and out of the waiting room and everything else like that. We are open for business. So the best way probably is to do one of two things. Either A, that you can go online at gbmc.org and look us up at Helping Up Mission. That's always a great thing to do. Or, certainly you can give us a call here at our office, and we'd be happy to see you here and get an appointment. One of our great staff will get you set up.
Can you give us a number? What's the number?
It's pretty easy. 410-826-0170.
Okay, Doc, I got that, and I want to hurry up and make sure that we keep this information out for everybody. Listen, I appreciate you checking in with us, Doc. Again, thank you for all that you're doing on behalf of the people that will be benefiting from your services being expanded from GBMC down at Helping Up Mission. And just say a good word to the fellas down there and tell them I said hello.
I definitely will. I really appreciate you having me on, and it's going to be our pleasure to serve. We have a great staff and a great team down here working hard to serve the people of Baltimore, and we're really excited to be here. I appreciate it.
All right. Hopefully when things loosen up, we'll get a chance to come back down and maybe just kind of be there to encourage the young men down there.
Absolutely.
All right. Thanks a lot. Here, Doc.
Thank you, Pastor. Take care.